So today we are going to talk about the salicylic acid peel. So salicylic acid peel comes usually in a 20 or 30%. The difference between the salicylic peel is it's a beta hydroxy acid. So it goes towards fatty lipids. So what that means is it will penetrate into the pore directly and go really deep into the pore and clean it out. So that's why it's really, really good for acne or more like blackheads, things like that. It really dives in deep into that pore and cleans it out. So that's the difference between all the other peels out there. Salicylic acid is extremely beneficial for more of that oily, acneic skin because of it diving deep into the pore rather than the surface. So meaning with it going into the pore, it's getting into those fatty tissues and deposits underneath. So that's why it gravitates towards that versus like a lactic or any of the other pills that are out there, okay? So any questions on the beta hydroxy acid or the salicylic peel? No? Feel pretty good with it so far? Okay. So now that you kind of know the basis of the peel, that's the difference between this peel and any of the other pills. Okay. So say if you get somebody who has hyperpigmentation, but they have blackheads, it's totally okay to use this one. I honestly say it will help with hyperpigmentation and it will help with the blackheads or their acne. So if they tend to get more acneic skin, I would always turn more to the salicylic base of doing a peel. Okay. So we're gonna clean her and then it's called like degreasing. But what it is, it's almost like an acetone or something just to cut off any of the oil so that way that the product can penetrate, you know, the peel can penetrate right away into the skin, okay? So I think I have Vaseline in here already, but we're gonna clean her. You don't have anything on your skin, do you?
Mm-mm.
I didn't think so. We're gonna do her chest too a little bit. So what I am going to use is you could do like an alcohol swipe if you want to. But I'm going to do the one that kills the bacteria from the green peel. You know, the little primer that you use first, it kills all the bacteria on the surface and it kind of like cuts out all that acid. I like to tend to use that a little bit more than like an alcohol swab. So we are going to use the gel.
Okay.
So this will kill a lot of that bacteria. So you just need a little bit. And it takes about a minute for it to really go in and work. So you just work it in there. So I personally think if she's up to it, I think we should do like a series of 3 of them because I think it will really help with a lot of the congestion through here and right through here. But it's up to you, and as far as like, because you're gonna peel, okay? So that means you're gonna go through 3 weeks of like peeling. So if you're good with that, this is the best time to do it with the winter time because she's not gonna be in the sun. So I would totally do it.
Okay.
But it's up to you.
Okay.
Yeah.
Is it okay if I see how this one goes?
Absolutely,
Okay.
honey. Oh yeah.
Okay.
No. You're not prone to have to do it.
Okay.
I'm just suggesting.
Yeah, because it sounds like a good idea, but just with school,
Yeah.
I don't know how. I don't know.
I know.
But,
I get it. You know, oh, there's my bowls. Okay. So we'll do this peel, and what we'll do is maybe book you like in a week,
Mm-hmm.
and we'll do the just a micro, and then if you're like good, just give us a call and be like, yeah, you know, I really want to do it, because we'll see how your skin does with it.
Okay.
See how it leaves, like it's spilt and it's left that white residue.
I see what you're saying.
Yeah. And you can buffer a peel out, so if you're not sure like what you think their skin's going to react to, you can take it and put it in here and do a pump of this if you want to kind of buffer it out, or you can put our aloe in with it, like a squirt of aloe to like buffer it, so then that way it doesn't make the pH as low.
Okay.
Do you know what I'm saying? Okay. Do you mind maybe stopping that and then videoing? So when I first start this, I do from a scale of 1 to 10, and I want them to tell me when they feel like it's at a level 5 or a 6. The reason why is because then I know I can buffer it, because it's only going to go up. Do you kind of get what I'm saying? Because you have no control of a peel. It just automatically goes straight. So once they're like, I'm at a 6, you know that when you go to buffer it, it's still going to go up probably 2 more levels. Do you kind of understand that? And you'll know once you start their skin, you'll know when they start to, it gives this weird coloring, and I'll show you. So we're going to start off on the area that I think is the easiest, which would probably be the cheek area first. So I'm going to go ahead and start, honey. It's just going to feel really like itchy. Okay. So I want you to let me know on a scale of 1 to 10 when you feel like you're about a 5. Okay. So we're going to start right through here. You feeling it?
A little bit, yeah.
Okay. So then what I'm going to do is I'm going to hit right in here just a little bit. How are we doing?
Good.
You feeling it?
Mm-hmm.
Okay. So now I'm going to really kind of get in here. So we're going to do... How are we doing?
Good.
Where you at?
About 4, getting to 5.
So you see how I do these areas last?
The ones that you put Vaseline on.
Yeah, because these areas are really sensitive. So you want to be careful. Okay, we're going to do right in here. Go ahead and lift up your chin. Where are we at?
About a 5.
Still staying there?
Yeah.
Let me know when it gets up a little bit more. See how she's getting white spots? See how it's turning white?
Yeah.
It's getting to about a 6.
Okay. Where's the worst?
The chin area.
Okay. All right. Where are we at?
More so 7.
Okay. We're at the 7, the chin.
Also around not the nose itself, but to
The sides?
Yeah.
Those are the areas that are first. So I want you to let me know when it starts to go down. Is it going down?
Not really.
Okay. Let me know when. Is it going down?
A little bit, yeah.
Now remember, water will make it activate more, okay?
Mhm.
So that's why you always put the buffer on first. How you feeling?
Good.
Let me know when it starts to go down even more. feeling better now?
Mm-hmm.
So she's buffering out now. You see how it went really deep right here?
And stopped.
Where are we at, sweetheart?
Getting to a 6. The
Okay.
forehead's the worst right now.
Okay.
Storage. Don't have enough space.
That's all right. You got a little bit of that at least. Okay. How are you feeling?
I don't know where it
Uh,
stopped.
Going towards a 5.
So it's going down?
Yeah.
Okay, good. I can put all that stuff on a drive. Okay, let me know when it goes down.
Everything except the forehead feels like it's gone down
Okay.
for pretty good.
I still have this, so.
It's all going down.
See how much better her skin looks?
Yeah, it does.
It looks really good.
That's crazy.
Okay, so now it's all kind of going down. But the thing is that we want to make sure that we get it all off. We don't want them to leave with any of the burning or the tingling going on, because you never know how deep it can get still. Do you know what I mean? It can still keep working.
Okay. Good. So those white spots are those spots you were talking about?
Mhm.
Okay.
And that's normal. That's kind of what happens with that peel. It's because it went really deep in those areas. That's why I remember I put the little Vaseline on there to buffer it out a little bit.
Mm-hmm.
Yeah, so she's just gonna peel a lot in those areas, which is fine. Okay, with any tingling or burning anywhere?
Just a tiny bit on the forehead.
Still?
Yeah.
Down in here or in here?
It's more towards the top.
Okay, up here?
Yeah.
Anywhere else?
That's it.
And then again, you don't really want to do heated towels with the peel, because the last thing you want to do is heat up the skin even more to activate a peel, you know, hotter. It's like putting fire on fire. So a lot of times if you have somebody that's like, my face is on fire, oh my gosh, cool towel. Just do a cool towel. Like do some of the aloe and then do a cool towel on there. How are we doing?
Good.
Okay. Is it feeling better now?
Mm-hmm.
A lot of times, sometimes it gets in that hairline, so you want to get it all off. Okay, am I missing anywhere?
No.
Good?
Mm-hmm.
Okay. All right, so now with her skin, what you want them to do is keep their skin completely dry, nothing on it. So tomorrow morning when you take a shower, you can get it wet, but no washing it.
Okay.
Okay? I do not want you washing your face until, let's see, tomorrow's Friday. Are you wearing makeup tomorrow to school, I'm
No.
assuming?
No.
Okay, so I would say if you're not, I wouldn't wash your face until Saturday morning.
Okay.
Or Friday night.
Okay.
The reason why is because then you just keep it clean, you get it activated, you know, it's gonna do its peeling. Now when you start peeling your skin, do not pick it off.
Okay.
Okay? Because then if you pick it off, you peel like fresh new skin, it could be a bad thing. So her skin looks really good. So what we're gonna do right now for her is I'm just gonna put some of the Pro Heal on her. You could do this, or you could do like Stem Factor. How are we doing?
Good.
Okay. So we'll do that. And then I am gonna put her under the light for just a smidgen, and then we'll do the same to your back.
Okay.
You good with that?
Mhm.
Okay. relax.